Hello and welcome to Voices 2021. My name is Princess May Visconde and I am a Community Engagement Manager at the Asian and Pacific Islander American Health Forum, and I will be moderating today's discussion on building sustainable NHPI communities after COVID-19. With us today, we have Sherry Daniels and Alisi Tulua. If you could please join me on screen. Hi, Sherry. Hi, Alisi. Welcome.
Hi.
Hi. Could we start off by you both sharing a little more about yourselves and your organization?
Alisi, if you want to go.
No, you can go first.
Well, Velina Maikako, good evening, everyone, afternoon, wherever you're calling in and tuning in from. My name is Sherry Daniels. I'm the Executive Director of Papaola Lokahi, which is the Native Hawaiian Health Board. And I'm so excited to be partnered with Alisi this evening for us to talk about, I think, what's very passionate to both of us and how we helped our community or worked with our community during the last 20 months during this COVID pandemic. So thank you.
Thank you, Sherry. Hi, everyone. My name is Alisi Tulua, and I am the project director with the Native Hawaiian and Pacific Islander Data Policy Lab, which is at UCLA Center for Health Policy Research. I'm also here at the invitation of the Southern California Pacific Islander COVID-19 response team. I serve as their data and communications lead. And I'm joining you all today from the Costanoan, Rumsen, Ohlone territory, which is Monterey, California. I want to make sure that I pay homage as a settler on these lands. And I'm looking forward to this, and I'm really honored to be speaking alongside someone that I consider a mentor and somebody that I look up to and learn from.
Yeah, we're so happy to have you both with us. The work that both of you do have played a pivotal role during the pandemic. When COVID-19 first hit the States, there was a delay in response by federal and state governments. How did you and your organization prepare and respond? And Sherry, we can start with you.
Thank you, Princess May. I think it's really, this is a really great time to recognize that our national COVID response team, which was really led on the continent and the efforts through many folks, I started to identify some of the high numbers that our Native Hawaiian and Pacific Islander communities on the continent were seeing. Around the same time, both myself and Dr. Keawe Kaholokula from the Department of Native Hawaiian Health at the School of Medicine at UH Manoa had a conversation about what is these numbers looking like for our Native Hawaiians and Pacific Islanders here in Hawaii. And that's when we, really had the conversation around what do we need to do to kind of almost catch the curve of it and get in front of what we were seeing happening, on the continent. And we, in our conversations, saw the need to bring already perhaps existing entities together, already to start addressing and prioritizing things that we saw were being done in our community, and we wanted to not be, one of the statistics in terms of numbers. We also brought in our Pacific Island partners and really created a collective group that currently started with about 20 organizations and currently is well over 60. Looking at our cultural values as guiding principles for us, we really did not want to reinvent the wheel. We wanted to come together with already existing entities, organizations, efforts, so that we could collectively use our resources. We also was very clear that we were wanting to make sure we're looking at data, collecting data, analyzing data that spoke to us and about us, and finally how we were brought and engaged at the table. That we recognized this was an opportunity for us to help engage our federal partners, our state legislators and departments, so that we could share our communities' access points, their information, so that we could come together and work on some of the emerging issues that we saw. Did we lose Alisi?
No, I was
Oh.
muted. I was talking to myself.
I do that all the time. I don't need the live stream for that.
Exactly. And I'll add to what Sherry had shared based on the work that we've been doing in Southern California. I think as folks, part of the community that is serving in a nonprofit space, many of us were really thinking about what we were going to do to help support our community as we normally do in any other situation. And one of the key instances that I remember prompted our coming together and forming the response team was an article that was written on the Sacramento Bee that highlighted the fact that Native Hawaiian and Pacific Islanders were disproportionately impacted. And the reporter was reaching out to community leaders to ask whether this was accurate based on what we knew on the ground. And so from that prompting, Dr. Ray Samoa reached out to community leaders in his network across the country and really brought together people at the national level. So that was really kind of the first move, was bringing folks across the country, mainly because many of us worked together already and knew each other and knew that we needed to coordinate our communities across the different states. And so the formation of the National Pacific Islander COVID Response Team encouraged regional coordination, which is then how, Kyawan Young, who is one of our warrior leaders that we recently lost at the end of September, was the Southern California representative on the national coordination of the response team. Felt like there needed to be coordination at a more local level so that we can help support our community more locally. And so then Cowan, with her decades of experience in community and her vast network, reached out to everybody she knew was doing community work in Southern California. And that includes key counties where we have high populations. And so that's LA County, Orange County, San Bernardino, Riverside, and San Diego counties. And she brought together those leaders, and that's how the Southern California response team was created. And you're right, there was a delay in at least resources being made available to community groups. But I'll share, I think, three key work efforts that we started without any resources provided to us. And the first thing, as Sherry said, was really making sure that we had data that our community organizations could use to advocate for resources. And some of that was, we really reached out to some of our existing relationships with the county health departments to ask them to please disaggregate our data when they're reporting it so that we have useful data. And then also asking some of our friends to help us interpret data and help us gather data. And that's how the NHPI Data Policy Lab was started, was at the prompting of some of our leaders, and they brought together some volunteers to scrape data from state dashboards across the country, just so our community organizations could have easy access to data. The second thing that we did was that we reached out to some of our friends, some researchers, people that we knew that worked in the counties, to ask them to help us leverage the resources that the counties had at the time. And so it's really useful to build good relationships with people. And then lastly, we really leaned into each other. And so we were starting to have weekly calls, and we were in each other's lives every day, talking about what work we can do, how we can leverage resources. Some counties had more resources that came out quicker than others. And so we were really sharing across county lines just to make sure that we can get something to support our communities before any of the resources were made available from the state and federal government.
I also want to add, Princess, before we move on, that the same kind of concept happened in Hawaii. That we did lean into each other and really into community, and I think that was the difference in this collaborative, both what we saw in Hawaii and across on the continent, was this really it being driven by community. And I think that's very different because we recognize that a lot of not only the needs were there, but we also recognize the strengths were already there. That if we could harness what was already existing, that we could also help kind of almost pivot and shift narratives, right? Of maybe future engagement. I don't think we saw that until midway, that piece, but that really was some of the, I guess, thread offs of what we did and when we came together was this really community, doing it for communities, irregardless. And so I think changing the philosophy and the trajectory of what we wanted the outcomes to be was really to help our community, regardless of organizational mission, agendas. It was really about how do we truly uplift communities for that positive outcomes at the end, which we didn't know what that was, right? We kind of was going, just holding hands in the dark, finding our way through. That's really what it felt like. So I think, seeing that collective coming together was very, I think, very unique to our communities, especially.
Yeah, definitely. And that's definitely something to highlight, because when it hit the States, you guys knew your communities were going to be impacted. And if you didn't do something now, no one else would step up if it weren't for you guys to advocate for your people, the people you work with, live with, and see every day. So that's extremely important. And then Elise also mentioned just data disaggregation. That data wasn't available till midway, as Sherry mentioned. So a Jabson study, John A. Burns School of Medicine study, reported that the highest rate of COVID-19 cases is among Native Hawaiian and Pacific Islanders compared to any other racial and ethnic group. When you found that NHPI communities were disproportionately impacted by COVID-19 in the data prior to the resources becoming available, how did your organization respond when it finally showed, yes, we're being impacted, and this is the work that we're continuing to do?
And I know Alicia is going to talk about the policy lab or the lab a little bit more, but in terms of for Hawaii, we actually had the very fortunate, I guess, position that our Department of Health played a role, sat at the table with us, with our 3R team. And actually through the work of DOCD, and that's the department, they actually started to disaggregate Native Hawaiians from Pacific Islanders. This is really, really important in retrospect, because through the weeks of the last 20 plus months, we were able to really track those case positives, and we could really use data to inform and, even with vaccination rollouts, really highlight communities via zip codes that had those large numbers and low vaccination rates. And so by disaggregating that data, and Hawaii is to this day the only state that disaggregated Native Hawaiians apart from other Pacific Islanders, that data actually showed us that we could track case positives, but based on our population, our state population of that community. And we were able to really show, that Pacific Islanders were disproportionately impacted in the beginning, but that once vaccination rollout started, the Delta variant hit, May 24th, we, based on data, could show when the Native Hawaiians superseded the numbers of Pacific Islanders that had positive COVID cases. That's really important because we could see what we were doing around that time, what types of messagings or what types of outreaches were being done. And I think that demonstrated the value of disaggregated data in this situation. So, I think there is a lot of value that communities can use, organizations can use to really be thoughtful in that showing the need. But we also, the data also showed us that when we were looking at pieces like the vaccination rollouts, when we're prioritizing based on age, for Native Hawaiians, when our life expectancy is under, right, the 75 and older group, that data was important to remind that our communities life expectancies under that. So how do we better support those efforts around messaging and supporting, informing our communities what was going on? I think that was really important in terms of the data.
So at the beginning of the pandemic, neither the SoCal response team nor the NHPI Data Policy Lab existed. And so both of these two entities that I'm here, that I'm privileged to be a part of, were created out of the needs that our community had due to the pandemic. So you can say our existence is a result of this work, and also still working to form ourselves as worthy of of serving our communities in our role. So, but I can say that as we were learning, I feel like in being in community, we knew that our community was suffering. We were hearing, because we are communal, because of the structures of our household, we knew that spread was going to be is going to move faster within our families and our households. We knew that we were at high risk for infection because of the proportion of our community that is in workforce that was deemed necessary to continue to work at the beginning of the pandemic. And so I think internally as a community, we knew that our community, even without looking at the data, our community was going to be impacted by COVID. So in our organizing ourselves, we decided that we needed to create ways to do effective work around key areas to help bring information to the community, and while also advocating for resources. So within the SoCal response team structures, we created work groups that were led by different community leaders, and a lot of our partner organizations just participated in whichever ones that they were willing to contribute to. And so, obviously we knew that communication was going to be really important. We needed to get information out to our community, especially information that is translated and delivered in culturally relevant ways. And so we created a communications work group. Obviously, the data piece is so important. So we had a data work group. We also had a community engagement work group that started to hold what we call talk story sessions that ran virtually. And really that was bringing our community leaders from different parts of the community to talk about ways that our families can help support their students during the pandemic while they were studying from home. We also brought together wives of our Samoan ministers to have a conversation about how they support the families within their congregation. So our community engagement group really thought creatively about how we can engage the community and help provide support in that way. And then we also had a resources work group, and they did a lot of work early on because we didn't have any money. We didn't have any resources specifically for our community. And so they basically combed the county websites in all the counties of our response team and gathered information, resources around rental assistance, food. Food was a big need in our community. And so they just put together resources by city when we identified cities where we have a high population, and they created resource lists for those. And we just disseminated that to the community. And then lastly, we had a policy work group that really was thinking about the kinds of discussions that was happening, especially around data disaggregation and how it's made available and accessible to the community. And then building relationships with policymakers who were having a lot of discussions, especially also around allocation of resources and funding. And so those key work groups that made up the structure of the response team really focused their work on those tasks to make sure that we were moving in a way that brings together our organizations and help to support just providing support for our families and also our organizations as they were on the ground.
And Alicia, I agree with you. I think if we did a side-by-side comparison of what we were doing in Hawaii and what you guys were doing in SoCal, but in other regions, Washington, Oregon, Utah, I think very similar, right? We had a similar structure, similar kind of committees that we were working on. And I think like everyone else, resources, meaning more money wasn't coming until, really the fall, towards, into the fall of 2020. And so I think this really demonstrated the resilience of our communities, that even despite, right, even without having anything, these community partners, entities, organizations brought not only the weight of the mission of their organizations, but like rolling up their sleeves and working. And so you saw orgs, from all shapes and sizes coming together really to help communities, because one of the realities of our NHPI communities is that regardless of resources, they will figure out a way to make it happen. And I think for many organizations, we all didn't know what that meant, but we knew we had to feed our community, we had to educate our community. I think these last 20 months, we talk about it in other spaces, that it really highlighted issues that were already simmering, prevalent in our communities, right? When, like Alicia, you mentioned about jobs that were deemed essential. We also know our communities were dealing with multi-generational, multi-family living situations. Many already had underlying conditions pre-COVID that would have had some impact with what was going on. And all of those things, right, the social impacts, not only the health impacts, were already present. And so I think many of our community were already waiting for that avalanche to come and spending time kind of almost like putting the sandbags, right, waiting for the tidal wave to come. And some saw it really quick, some saw it later on, some saw it towards the end and are still kind of coming out of that. So I think the biggest piece we took away was that if we really listened to our communities and these organizations that have trusted interests and relationships, I think some of the things we could have maybe caught earlier on, maybe were able to reduce numbers. I want to believe that there was so much strength and already existing knowledge that we recognize. I don't know if everyone recognized that. And I think that was part of, the resources out there as well.
Yeah, that's a great point. Indigenous communities and peoples had longstanding concerns way before COVID-19 existed, but COVID-19 really put that in the forefront. And so now we saw how there is a rapid response for NHPI communities during COVID-19. But how do we address these pre-existing and underlying inequities that weren't recognized prior to COVID-19?
I don't know. That's a deep question. I mean, I think that's a loaded question, because if we talk about that, then we have to recognize there's systemic issues. I think we are so easy to say all these pre-existing conditions, social stuff, but another piece of the puzzle, another just reality of it is systemic. I think for our experience with the Department of Health in Hawaii was, I think they really recognized and tried very hard to integrate in language appropriate messaging, to have it really be accessible, to support as best they could. But I also think that you're looking at just a narrow department, right? When we look at this systemic needs and challenges, it's a bigger issue. It's not just one department or one island or one community. It's spreading across. And I think it really highlighted the realities that I think many people already had pointed out, recognized, and yet it was right there. It was really the elephant in the room, this time wearing neon LED lights. And so, I think other things that were happening across the country in terms of the social justice pieces also added another layer of this. So I think we'd be remiss if we didn't put on the table the systemic inequities already. And what did that mean? Because I think communities and both Alicia and I and our different response teams were busy responding. And so, in our response team, we also recognize that what were we going to do after? What were we going to do as this pandemic weaned or shifted or changed? Because all these things would still be here. It would just be different, right? And so how do we actively engage in a way to change the narrative, to shift the pendulum a little bit? And I think that is for us where we are right now, and in holding accountable not only ourselves and our community, but those resource holders too. And I think community is a really good place to watch, because before COVID, before all of this, they still were resilient to exist. And I think that's the hard thing, is we keep pushing the narrative of, our NHPIs are so disparate. We have all these high numbers, all these challenges. Yes, let's address that. We recognize it. It's there. But before that, we have a narrative and a history that's so rich. And I think we also have to recognize that, okay, so if we don't speak up, if we don't say not us, not now, then when, then we're also, perpetuating that. And so I think that's really a place of organizations and communities standing in their truth around, okay, we're trusted. Now it's out there. What do we do with it? And I think that's just a reality that conversations need to be had more, and to be safe to have them. I don't think we're pointing fingers or blaming. We're just saying it's out there. It's right in front of us. So we can either choose to address it or put a napkin over it and keep on going. And I think most communities, and Alicia, correct me if I'm wrong, that we've worked too hard during these last 20 months to not want to continue to be thoughtful and look beyond COVID, and to continue to uplift.
Mm-hmm. Yeah, I agree. I think many of us that have participated in these efforts over the last 20 months are committed to continuing the work that we have started through the pandemic. And to answer the question, how do we address the inequities? The real answer is, as Sherry said, the system needs to be changed so that any health equity approaches center those that are most affected. And I know that that's something that won't happen overnight, but I believe that those of us that are in this work really truly believe in that, and not just to say that our NHPI community needs to be at the center of this by ourselves, but also our Indigenous communities, our Black communities, our Latinx community, our Asian American communities, those that are impacted disproportionately by inequities need to be centered in any equity-driven work that's done. So what does that look like for us on the ground? I think, we've been thinking about this a lot. And one of the things that, one of the ways that I think this could work is to position ourselves across all the ecological tiers, from policy, institutional levels, community, more local community levels, all the way down to the smallest units of our community, which is the family. Many times, a lot of the health prevention or public health work focuses on the individual, which doesn't work for our community when our smallest unit is a family. And I think that's something that we've also learned over the work that we've done during the pandemic, is how we center the family in considering our approaches for our communities. And then the second thing that I think that we can do to address inequities is to strengthen the cultural frameworks that we have started to really tap into and amplify during the pandemic. and not just for the sake of strengthening it, but using it to address root causes of health disparities. And one of the biggest root causes is racism. I think that there's work that we need to do and strengthen as NHPI organizations to continue to work to continue anti-racism work, because that is the root cause of many of these disparities that was amplified during the pandemic.
Yeah, just from echoing what both of you are saying, it really goes back down to communities and helping them thrive. As Sherry mentioned, NHPI communities are resilient. You hear that so often. And through my own learning, I see how unique cultural values and practice allow the community to flourish. As a community, NHPI communities and other communities as a whole, how can we continue to advocate for and uplift NHPI communities?
I think standing in your truth, I think that's a really big ask, because it's really hard when we often do things that's tied to resources, to money, to being offered a space at the table. But I think it's also asking where these other people at the table are. I think we all hold space. We all have opportunities to be invited in, whether it's as subject matter experts or is part of a neighborhood board or in other spaces. I think it's okay to ask, is it just me? Where are my other peers, whether it's in other Pacific Islanders, Asian Americans, Black, other marginalized communities? I think to ask where, right? And to really understand your lane and be okay that you're not needing to speak on behalf of all. That, sometimes you need to say that this is my boundaries, and that you need to include more, and not feel the need to be tokenized. I think sometimes people invite us because for whatever reason, and it's okay to ask, and it's okay to include and invite others to the table, because that's where the rich conversations come. This is where we're demonstrating the need to be truly inclusive, and to start shifting those systemic issues from racism to injustices, all of those things. It's those little efforts and little steps. Sometimes it's a little hard because that's not often the direction we've taken in the past. And so I think it's just going to get some getting used to. And I think there's ways we can do it that's very empowering, but also sends a very clear message.
Yeah, so it's just to add to that, I wrote down 3 sound bites, because this question is always asked, like, how can we advocate for NHPIs? How can we uplift the community? Number 1 is bring us along. Many times we're not invited because we're not seen, but we definitely have friends that get invited all the time. And so we ask folks to bring us along with you. If our community is not listed, add it to the list and advocate for our addition to the list. And if not, just, email one of us. We'll come along as your +1. So the number 1 is to bring us along, invite us, create room for us. The second one is to listen to us. We know our communities. We have many wonderful leaders, and I'm not just talking about our elder leaders. We have a lot of young people who are driven and love and committed to our community, and have great ideas. So when we're in the room, listen to what we have to share, especially when it comes to what is best for our community. And then last but not least is let us do our work. many of us are decolonizing many things that we've learned and taught to us as best for our community. Many of us are strengthening our ways of thinking about culture and how it gets incorporated into our work, or how we center that in our work. And so allow us the space to do that instead of imposing best practices that have never worked for our community on us. So yeah, I think those are the main things is, bring us along, listen to us, and let us do our work.
I wanted to throw two more things in, Alice, because I totally agree with you. I think it's trust. Build trust with us. Don't assume you have it. Build it. Earn it. And then I think the fifth one for me is know your lane, know your space, right? I think we're very generous. We're going to share, we're going to reach across, we're going to do all that. But I think know your space, know your lane, because I think it helps to just uplift and empower, right? More of us doing it, we can accomplish more. So yeah, I totally agree, Alice.
I love that. Thank you both. Going on to the next question. So again, talking about COVID-19, it has been a huge priority, and you both touched about it a little bit, but what's next? As the pandemic shifts, as we reprioritize, what is next for your organizations and the work that you both do?
I think for our Native Hawaiian Pacific Islander 3R team in Hawaii, we've already been talking about what does the work look like. When we were a year in, we were looking at, okay, so what next? When, several months ago, we've been, okay, because the reality is people, organizations are tired. We are just exhausted for many reasons. And I think, the thought about it continuing longer just seems even heavier of a burden and heavy. And so, we've been talking about, so what happens? Because we do all these great things. There's things we've learned, right? We've learned a ton. And so what does that just go away? And I think we've looked at how do we pivot into a space of recovery, and what does that look like for communities? What do we look at in terms of economics, in terms of food sustainability and food sovereignty? Because we saw that as a need, right? That during this pandemic, people, the food distribution piece, what does that look like, especially in Hawaii? The mental health, all of these other things that the physical health associated with, having had COVID for those long haulers. So I think there's so many things that are rising up that, we still need to figure out, how do we help our communities navigate? How do we help each other address resources? I also think as organizations have had to pivot, have had to really change the way they engage with community, with each other. What does that look like, right? How do we, adjust the trust we have with each other? So I think there's a lot of those relationship building, but also along that, the work. Where does this go now? How do we manage when resources are going to be changing and shifting? So there's a lot of those that our 3R team has been looking at. Not only what's happening in research and data and all those other things. So a lot of, I think, thoughtful thinking that we're going to have to engage in.
And so for our work, I think something that we've already started to do is to think about how we continue to build our capacity to be of direct service to our communities. And the SoCal response team is made up of, nearly 20 community organization partners that cover from Central Valley of California all the way down to San Diego. And part of building our capacity is, how do we maintain and sustain the organizations that exist right now while also building on the work that needs to be done for our people. And so the other thing is, we're having conversations about anticipating what is to come because of the pandemic. So as Sherry shared, one key worry we have is, how do we support those in our community who had COVID and are impacted by, long COVID. And so thinking about those kinds of things, mental health support is going to be key in our community. There were already no services for our community around mental health before the pandemic, and to have been impacted severely in this time means that our community is going to need it even more now. And so thinking about how do we build in these infrastructural pieces to continue to support what we anticipate will be needs coming out of the pandemic. And then last but not least, I think what's next is how do we cultivate the next generation of workers for our community? And not just for the sake of having employment, but people that are dedicated and committed and are rooted in our cultural values that can continue to be of service for our community. And we don't want to be in the same position should there be another pandemic or another similar situation. We don't want our community to be first in this respect. But we want to be prepared to continue to support our families should there be a need for us to step up. So we need to build workforce programs, support, and continue to create opportunities for our young people who have really stepped up over the last 20 months to show that the future of our community is going to be in good hands.
Thank you both. Just kind of going into the last question, but you both kind of already mentioned it, but is there anything you both would like to add about how we can continue to build sustainable NHPI communities?
I think, and I think Alicia has talked about this too, right? That it's about staying connected and with our communities. I think so often when there's not an issue, a challenge, right? We kind of just let it be. We are focused on other things. I think it's really important that we stay engaged with them, that we continue to foster relationships with communities, but with each other. And I think to also have to look ahead, not just look behind us, and which is important to learn, but to look ahead so that we can be very planful and thoughtful in moving forward in addressing some of the bigger issues that we know are there, systemic things. I think we have to recognize we can't do it all alone. And how do we come together and continue to be really great partners and allies to invoke change? So I think that's where we're looking at moving forward.
Yes, so I one of our biggest strengths as a community is our ability to band together. And so I know that was evident in the work we did as response teams, not just in SoCal, but our national organization, our national groups, our ability to come together and create work and build strong communities together. And what we're seeing is we have additional organizations that have stepped up and have formed because of the pandemic. So we have a couple entities at the national level at this point. Whereas, maybe a decade ago, maybe there was one or two. And so the strengthening of the ways that we come together, we're, looking at how can we organize our community statewide, thinking about California, or how do we strengthen our work at the local level? So we're already starting to position ourselves at these different places. I think as we continue to focus on some of the key issues that we want to address for our communities, we're starting to think about how do we position ourselves in more than just being in community. And I can speak for our presence at the UCLA Center for Health Policy Research as the next level of, 10 years ago, we were doing our community data work, mining data alongside some of our allies who helped us put together demographics reports and policy reports. And now we've inserted ourselves into an academic institution. And so I think we want to continue to position ourselves into these tiers and places where we can continue to make impact. And that's all based sometimes on the relationships that we build with people that we work with, people that we serve alongside. And that goes beyond just the relationships we have with each other in our community, but with others that are outside our ethnic communities that have been longtime friends and continue to support our work.
Great. Thank you so much. Thank you, Elise and Sherry. We've reached the end of our session, but the conversation, so fast. The conversation doesn't end here, though. I encourage everyone to continue to uplift and advocate for communities. As Sherry and Elise mentioned, see who isn't invited to the table, bring them along, allow them to speak for their communities, allow the community to speak for themselves and advocate for themselves. So thank you so much, both of you, for being here and sharing your insight, your thoughts, your knowledge, and all the amazing work you've done these past 20 months advocating for NHPI communities. So
Thank you.
Thank you.
Then I wanted just to thank everyone for tuning in. I hope to see you tomorrow for day 2 of Voices. Thank you.